Hey everyone, welcome back. So this week we're going to deal with an exercise that is regional interdependence heavy. There's a lot going on in this exercise. So we're going to jump right in and get to work. Now, the reason that we might want to do this exercise, the reason that I prescribe this exercise is because there's significant low back pain, maybe right down the middle, maybe just one side or the other in one of those sacroiliac joints. There could even be significant hip pain. A lot of times there is significant hip pain. Also, pain at the knee. If the hip is stiff, if the low back is stiff, then one of the places that force has to be absorbed and distributed is at the knee, maybe even at the ankle. So if you're dealing with some regional pain, maybe even some just localized pain, if we get the diagnosis right, this is a very, very powerful exercise. So in this case, what typically happens is one side of the pelvis typically has an obliquity. So what that means is one side of the pelvis is actually twisted or shifted forward. So in this case, it would be the left side. The left side shifted forward is actually more common. And so I tend to prescribe the exercise in this position quite frequently. So the setup here is that there's a pillow between the feet, and there is a pillow or a rolled up blanket or towel between the knees. Now you'll notice that this hip is at 90 degrees and this knee is at 90 degrees. Also, both feet are against the wall. In this case, the wall is, in a sense, the floor. We want to coordinate the right and the left hip, the top and the bottom hip. So to begin, what you noticed is that the first thing I do is I reach the hand forward. That allows me to kind of, in a sense, round out the low back, taking the paraspinals, those low back extensors, out of the equation for the most part. We don't want to try to stabilize the hips or the pelvis by using our lower back extensors. We want them to be relaxed. Once those are in place, now I very gently press my bottom foot, in this case my right foot, into the floor. Keep the right foot flat. Try to stay kind of evenly distributed between the heel and the forefoot and the ball of the foot. Once that is in place, so now that right hip is engaged, that right hip is stabilized, we're going to begin mobilizing the left hip using not just the adductors and the hip musculature, but also our breath. So you can see that now that right hip is pressed into the wall, I'm going to inhale deeply through the nose, fill all the way up, and pull that left hip, that top hip back. Once it's back there, I want to hold it in the retracted position. Don't let it come forward. And I'm going to very gently, but very firmly, exhale through the mouth and press the knees together. Squeeze the knees together. Then inhale through the nose, pull back, exhale through the mouth, squeeze the knees. When you're inhaling through the nose, even if it's just 1/8 of an inch, don't worry about getting 2 or 3 inches every time you pull that left hip back. Just the slightest amount of retraction is helpful. So you'll want to repeat this exercise 4 breaths. 4 breaths is 1 set, and then repeat the exercise 4 times for a total of 4 sets. Once again, the reason that we want to do this exercise is because it is a regional independence exercise. We round out the low back, we take the paraspinals and those tight low back extensors out of the equation. We engage the bottom leg, the bottom hip. That allows us to kind of set things in place, engage the core as we begin to mobilize that left hip back. This, again, will decrease tension in the lower back, in the hip, and even in the knee and the ankle. So thanks so much for watching. Please send me your questions. If you're wondering if this exercise is right for you, if you're wondering if this exercise can help your low back or your hip pain, please give me a call. Come on in. We'll get that complete diagnostic workup. We'll get that regional interdependence look, that systematic approach that's going to tell you whether or not this exercise would actually be helpful for you. Thanks again. I will talk to you soon.